This segment of Delmarva Life is brought to you by Peninsula Home Care.
Okay, let's play a little audience participation time here. You get a headache. What do? Well, most of us take a pain reliever.
And if you have a more serious health issue, your doctor might prescribe medicine for that, or you might reach into your medicine cabinet for vitamins or other dietary supplements on a regular basis. The fact is, 4 out of every 5 U.S. adults will use prescription medications, over-the-counter drugs, or dietary supplements. And nearly 1/3 of adults will take 5 or more different medications. But if you're not careful, those medications can do more harm than good.
So our next guest is Sandy Russ, Peninsula Home Care Branch Director in Seaford, with some advice on how to avoid making a mistake when it comes to taking medications. Thank you so much for joining us,
You're
Sandy.
welcome.
You know, I'm really kind of involved in this myself because my wife just had surgery, and suddenly there's a whole bunch of medication that's becoming involved in our situation. It's not hard to understand how these mistakes happen, and it happens to a lot of people, doesn't it?
Right, it does. When you get out of the hospital, you should have a list of your medicines written down. You want to make sure each medicine is in a separate bottle. You don't want to be mixing your medicines.
Right.
Also, pill box.
Yeah.
We have pill box here that you can put your pills in so that you won't get them mixed up.
And those are kind of solutions to the problem. Why are people making these mistakes?
When they go to, say you have a cardiologist, your primary care physician, and each one orders different medicines, and one doctor doesn't know what the other doctor ordered, so they just keep getting more and more. So, but we do have.
So somebody needs to keep track, and it needs to be you, doesn't it?
Yes, when we go in the home, when we get a patient, we go in the home and say, bring us all your medicines. Go through your whole house, bring your non-prescription, your prescription, your vitamins, everything. And then we sit them down there on the table.
Yeah.
And the papers they got from the hospital, we match up to what they were on. And what they're not on, we'll write it down, then we'll call the primary care and say, okay, this is what they're on, and what do you want them to be on?
Yeah.
And then we make a follow-up appointment. They'll take all their medicines, and the doctor will go ahead and say, okay, I want you to be on these medicines.
And you see this happening a lot with elderly people,
Correct.
don't
Yes.
you? Yeah.
Yes.
Why?
Because they're just going, well, they really need a list
Right.
to be writing down all their medicines so that when they go to one doctor, they'll take it to the other doctor, and then everybody can be on the same page as what medicines they're taking.
So what is this thing you're holding here?
It's a medication list.
Right.
It has, you put the name of the medicine on it, the strength, the frequency, and the time you take it.
And then just keep this handy.
And then just every time you get new medicines, you just add it to it. And then when you go to your different doctors, just take it right there, and it's.
And that's just one solution
Correct.
to making medical mistakes. We have others we want to show you here. I mean, these are actually things you should do to avoid the medical mistakes. You can always follow the instructions from your healthcare provider regarding prescription dose and frequency. Don't chew, crush, or break any capsules or tablets unless instructed. Don't stop any of your medications without discussing it with your clinician. Never place more than one type of medication in the same bottle. I know a lot of people do that.
Right.
Keep a list, as you said, of your current medications, including, and don't forget the over-the-counter medications. That's important too. And then properly dispose of your expired and discontinued medications. And there's other ways. You have all kinds of, something there that you actually can have your pills day by day.
Yeah, this is from the pharmacy. They pre-package it so that all you have to do is pop it out. You just push it down and it pops out
Okay.
on the back.
Simplifies that, doesn't it?
Yeah.
And they also have the strips that we've seen too, where they actually take, if you're taking 5 pills in the morning, those 5 pills are in.
Correct. That's just a different type of packaging, but most pharmacies do that now.
Yeah,
Which
we're
is
seeing
great.
this from Apple when we visited them, and they were putting these strips together. That's really interesting too, because if you tear one off, it has the information what is actually in the package.
Right. Yeah.
All right.
Put that there
All
for
right,
you.
so let's talk about getting rid of the medications that you don't want or you don't need or you don't use anymore. Some very important things here. Some really good tips as far as disposing of your medications. Follow any specific disposal instructions that are on the drug label. Whatever you do, don't flush the prescription drugs down the toilet unless you're specifically instructed to do that. Right. Take advantage of community drug take-back programs. We have a lot of those around here. If there are no instructions on the drug label, just throw it in the household trash. But first, take them out of their original containers and mix them with an undesirable substance like coffee grounds or kitty litter. I had never heard of this before.
Right.
Why?
Because you're talking about the kitty litter.
Yeah,
Because
yeah.
it absorbs. Because like
Oh, okay.
Oh,
Yeah.
that's interesting. But you don't want them
And-
all together in
No.
the container.
you can't. I mean, like your capsules. You want to open your capsules. Like put it like in a baggie or something. Then add the cat litter.
Oh, okay. All
and
right.
then zip. You know.
Because who's going to want to go through the used kitty litter to get the...
Exactly,
Okay.
yeah.
And of
There we
course,
go.
if there's any doubt, talk to your pharmacist.
Yes,
Your pharmacist
yes.
has all the
Sandy, thank you
information.
so
No
much.
problem.
Wonderful information there.
And if
Thank
you would
you.
like more information on medication safety or to learn more about Peninsula Home Care, go to our website, delmarvalife.com. Click on the Show tab, now located on the left side of the page.